Welcome to Bad to the Bones, the podcast where we discuss everything related to orthopedics, joint health, and living an active lifestyle. I'm your host, Debra. I'm joined today by Premier Orthopedic Associates Marketing Director, Rita Cangi-Kramer. How are you today, Rita?
Deb, I'm wonderful and so excited to be here to discuss important topics on orthopedics and introduce the listeners to Premier Orthopedic Associates of Southern New Jersey.
I'm so excited today as well. Our first episode today, we really want to get into what exactly is orthopedics, talk about some joint health and explain to the listeners what the mission was when Dr. Dwyer started the practice years ago. So, Rita, today, let's jump into it. Let's start with orthopedics. What is orthopedics so we can explain to our listeners?
Great question. So orthopedics is a medical specialty focusing on the diagnosis, the treatment, and the prevention of injury, as well as disease related to the musculoskeletal system, including bones, joints, muscles, ligaments, tendons, and even nerves. There are many subspecialties in orthopedics. So when you talk about orthopedic medicine, the subspecialties fall under one, sports medicine. We have both non-operative sports medicine and operative sports medicine.
Right.
So non-operative is more of what we do. Those specialists do injection, viscosupplementation, where you get an injection to calm down a joint, helping with pain and improving function, as well as some of our physicians who are osteopathic can do some manipulative maneuvers to help keep things in balance when you have a little bit of an imbalance. And then we have operative, which is orthopedic surgeon, specializing in arthroscopy, so sports medicine arthroscopy. Arthroscopy is a minimally invasive surgical procedure on the joints.
I feel like a lot of people, when they think about orthopedics, they immediately think it's surgery. I'm going to have surgery. So, to hear that there's a lot of other things. I mean, there's pain medicine, right? Pain management. Yeah. It doesn't always have to be surgery, right?
Yeah, well, that's under sports medicine. You have both non-operative, which we see most commonly.
Yeah.
And then occasionally when you have an athlete that's injured and they require surgery, most of the time it's a soft tissue, and arthroscopy is a way that they can go in and examine and then treat that particular problem that you might be having, whether it be a meniscal tear or an ACL or MCL tear.
Yeah.
That's what arthroscopy. Arthroscopic surgery with orthopedics has been game-changing for orthopedic surgeons. And it's a minimally invasive procedure where they can actually evaluate, treat, and go on from there.
Yeah.
So in addition to orthopedic sports medicine subspecialty, you have neck and spine surgeons, another subspecialty, interventional pain management or interventional pain medicine, which you mentioned, Deb.
Yeah.
Specialist hand and wrist and microvascular specialist. Joint reconstruction and orthopedics will be joint replacements. Physical medicine and rehabilitation subspecialty, which is more of the conservative treatment.
Yeah.
And then there's occupational medicine. So when you're working and you get injured, or you're working and you want to stay well, occupational medicine and work injury is also a subspecialty within orthopedics.
So how about Dr. Dwyer? What was his mission when he started this practice?
So Dr. Dwyer started the practice, Premier Orthopedic Associates, back 26 years ago. And he was the founder and the CEO of the practice. And Premier was then and still today driven on two fundamental goals. First, to deliver academic, quality, specialized orthopedic care right here in your backyard. And second, to provide orthopedic care in a convenient one-stop shop model in the communities, within the communities that we all live, work, and play.
Yeah, it sounds like he is providing this university-type quality orthopedic care in hometown communities versus having someone to drive to the big city. And he's doing it well, working on your 11th location, which is really exciting.
It is.
Very exciting.
In South Jersey, Deb and I are both from over the bridge in the Delaware County area. We have so many people that have transplanted and live here today like you and I do.
Yeah.
Every day I talk to someone else that I meet that used to live in the city and think they have to go back to the city for care, when in fact the quality of care and academic care that you're getting right here in your backyard with convenience to your lifestyle and your work and your play.
Well, and Dr. Dwyer has been very focused on spreading the knowledge and the importance of joint health because, you know, it is so crucial. We hear a lot about keeping your heart healthy, right? Yeah. But we don't really talk too much about joint health and why it's so important. And I know you are an expert in this area, especially the heart. So let's talk a little bit about why we need to keep our joints healthy.
Deb, that's so funny. You know, I spent most of my career working in hearts, the first part of my career.
Yeah.
Because now I'm in the latter part of my career, and now orthopedics. So funny you should mention, because working in hearts and now orthopedics, there are so many similarities.
Yeah.
Joint health is critical to our ability to live a functional and active lifestyle, and so is heart health.
Yeah.
You know?
Yeah. They kind of go hand in hand.
Yeah. Both hearts and joint health are critical to living the life that we've learned to love.
Yeah.
And just in a different way.
And as we're aging, that living life the way we love is, you know, becomes more difficult because people are living with joint pain. And I feel like a lot of people have just come to terms with, oh, I'm getting older, joint pain is part of getting older. And I'm sure that most patients present with symptoms of joint pain. What would be some of the common conditions that we can share with our listeners of what is the cause of joint pain?
You know, Deb, you mentioned really kind of an epidemic that's kind of going on. We have an older population.
Yeah.
We are staying alive a lot longer. You know, I can think to just a few weeks ago, we've had a patient we've been managing, she's been 102.
Oh, wow.
With quality of life.
Wow.
So to keep someone with quality of life and living life with their families that they so love is really amazing. But conditions such as osteoarthritis, which when you get older, it's common. And the more you've used your joints, the more common it becomes. And that's what we want. We want to live an active lifestyle. So our osteoarthritis, it's like your tires on your car. When they are worn out, you replace them.
Yeah, our joints have so many miles we can put on them before they wear out and need to be replaced.
You know, time and time again, I hear our orthopedic surgeons do presentations to the community, and we'll be bringing some of them on in future episodes, but they often talk about an analogy of the tires on the car.
Yeah.
And of course, they all love sports cars. So
yeah, of course, of course.
That's always it too. Overuse syndrome. You know, we use our joints. If you're a runner, you constantly are using your knees, your hips, your ankles, your feet. Sports injuries, both old and new. If you were a previous athlete and now a retired athlete or a senior athlete, and that is also what we see in wearing down the joints. Fractures, strains, and sprains, all of these things can cause joint pain and impair function and the ability to move without pain. Our musculoskeletal system was meant to move freely.
Yeah, I was just going to say that, you know, it's kind of like a double-edged sword. You know, you want to live an active lifestyle, but with that active lifestyle comes wear and tear, comes the potential for strains or sprains. You know, it's worth mentioning, you know, I said it a few minutes ago, but we don't have to live with joint pain as we age. It's not really a part of the natural aging process other than the wear and tear, right? Like just wearing out. And so seeking proper diagnosis has become, we're really just trying to spread awareness about that, you know, that you need to go to the orthopedic and, you know, specialist and just get yourself checked out. What do you think are some of the preventive measures that people can take to avoid some of the wear and tear? I mean, injury is what it is, but is there anything that people can do to avoid the wear and tear or just be more on top of it?
Absolutely. You know, the musculoskeletal system was really meant to move freely without pain and inflammation. But the reality is when we use a certain joint on a regular basis, you may get inflammation.
Yeah.
Especially if you have a joint that was impaired or tore something in the past. You know, later in life, when you go to use it again, it could cause some inflammation.
Yeah.
Orthopedic specialists, our orthopedic specialists at Premier and across the nation are highly trained to restore patients back to their peak performance. and treating every age and every injury. Our providers can evaluate, treat, and strive to return patients to play, work, and live in the life that they can without pain. So absolutely, strong and healthy joints are important. They allow us to move freely and have flexibility.
Yeah.
Healthy joints also help to absorb shock, maintain balance and stability, and protect your bones and other structures around the joint, soft tissue, from damage. So seeking an orthopedic evaluation early is essential for proper diagnosis and proper treatment.
Yeah, absolutely. I mean, just living a healthy lifestyle, healthy eating habits, don't push anything to the extreme, everything in moderation. One of the questions I think a lot of our listeners might be interested in knowing, even personally, how do I know when I should go see an orthopedic specialist versus just go to my primary care physician?
That's an interesting question, but if you don't mind, I'm going to answer a few more things in that last question you had. Orthopedic providers can help navigate to get you back to the level of performance that you need. For instance, some of the lifestyle things, exercise. Exercise is medicine to the joints. The musculoskeletal system likes to be strengthened. It likes flexibility, and it likes vasculature or the cardiovascular system wrapped around it to stimulate blood flow. These things provide such things like enhancing bone density, building muscle, improving flexibility, proper circulation to release joint lubricants and stimulate protein growth and repair when in fact there is injury, and reduce inflammation. Also maintaining a healthy body weight or body mass index. You may have heard of BMI. That's very key. Your body structure was meant to hold a certain body mass, and it's really important to take that into consideration.
Especially when someone is going to have surgery, their body weight is pretty crucial as well, right? It's very considered.
Absolutely, particularly for someone who's having a joint replacement. Just know that the doctor's going to have that conversation with you because the recovery means a lot in how you recover if you're carrying extra mass, right? The other thing is good nutrition plays a role in joint health. Common foods and supplements that you'll hear orthopedists talk about are omega-3 fatty acids, vitamin D, vitamin C, turmeric, antioxidants, green tea, berries, olive oil. A lot similarities to this heart. There you go. So eating healthy is really important, not just for joint health, but for overall wellness. And avoiding unhealthy things like smoking,
alcohol,
excess body weight, excess sugar, excess alcohol. Those things don't help the recovery process. So bottom line, exercise has numerous benefits in joint health. And I'm talking about muscular strengthening, flexibility, and cardiovascular. And if you're pounding the pavement but you're not strengthening the muscles around those joints, you could have issues. So really an overall wellness structure is really important. However, if you experience ongoing joint pain, it is a good idea to seek orthopedic evaluation to see what's going on sooner than later. Don't wait. At least be evaluated. Just because you come to an orthopedic doesn't mean
that you're
going to
have to have surgery. Well, and that leads into my question. How does someone know to see an orthopedic specialist versus go to their primary health care?
And Deb, I'm sorry for getting off
No,
the tangent there,
that's fine. You had a lot of good information to add.
In medicine today, we have excellent options. So direct access to orthopedic care is something that Premier Orthopedic Associates prides themselves in. So if it's during the day between the hours of 8:30 and 5, Monday through Friday, you can access the orthopedic directly, unless your insurance company requires you to have a referral. A primary care, you would have to see to get that referral. You can even call us, and we could even try to call the primary care to see if they would give us a referral if you have been regularly seen. Primary care physicians are the physicians that see you in your wellness. In your routines of making sure you have all the blood work that you need, making sure you're staying away from disease processes. If you have hypertension, they're following it. If you have other disease processes, they're following it. And when they feel you need a specialist, they will refer you out. but you have to have a relationship with your primary care physician.
Yeah. I mean, I guess like my thought is, do you think most people know that, oh, wow, I sprained my ankle? Do I go to urgent care? Do I go to my primary care? Do you think most people know, like, oh, that's orthopedic related? That's where I need to go for that?
Maybe not. So what I think is in that situation, and I have kids, you have kids, they were athletes. When my daughter sprained her ankle, it was 7 o'clock at night. I went to the urgent care.
Okay.
And the reason I went to it was open till 8 o'clock at night.
Yeah.
And I could at least get the high level initial evaluation.
Evaluate it, yeah.
Get the x-ray.
Yes.
Orthopedics always needs an x-ray first, because we need, number one, check to see if there's any breaks.
Yeah.
Because an orthopedic is going to always, that's first line care. Let's just make sure we don't have a fracture. Once that is the case, at the urgent care, they can put you in an immobilizer that will hold you over for 24 hours.
Yeah.
Till you can call, text, go online, and request an appointment with the orthopedic. But they're going to tell you, make sure you see an orthopedist.
Yeah.
You need to be followed up, because this looks like a high-level sprain. This looks like a very bad sprain. You've got a lot of swelling. So in the meantime, you're going to rice. You're going to rest, ice, compress, keep something, like an ace bandage, and elevate. So rice is always a good...
We hear that a lot. And that's, I think a lot of people have confusion on that. I mean, I myself, I've used heat when I shouldn't, or I've iced something when I shouldn't. That's that's something to really truly learn, because it can reduce the pain, reduce the inflammation one way or the other if you don't use the proper heat, heat when you're supposed to use heat, or ice when you're supposed to use ice.
In orthopedics, we always recommend ice is safe, ice first. And then within 24 hours, get yourself to an orthopedic, who will tell you what the next step is. So
Premier Orthopedic Associates is really spread across the southern New Jersey counties. Mm-hmm. Give us a little idea, where are we located? How far wide are we spread?
We are across southern New Jersey in 5 different counties, Deb. Today we are in Cumberland County, we're in Salem County, we're in Atlantic County, we are in Gloucester County and Camden County.
Really blanketing the whole area.
Yeah.
It's fantastic.
Yeah, so we can service you wherever you are. We have offices and 36 providers that help to care for our patients across 11 locations. As of May, we'll have 11
Complete
locations.
Complete access to care, 24/7. Even, you can text or call 24/7. Someone texts or calls after hours, they'll be responded to promptly the next morning, right?
Absolutely. Our access number, because we pride ourselves in access, is 856-690-1616. And that number, you can call anytime. You will get a live agent, and you can text anytime and get a live agent during the hours of 8:30 and 8 and 5 p.m.
Yeah.
And then when we're not in the office late at night, if something happens, or on the weekend, we have folks that are monitoring that early that next morning and getting back to you. Just know this. If you are that patient that had a fracture because you were tripped on a curbside, that next morning we prioritize that. We triage that person to get seen that day.
I love that. I love that whole concept of the texting ability too, because, everyone's lives are so busy lately. No one wants to sit on hold. And the texting feature is so convenient to schedule an appointment, get a prescription refill, send a message to the physician, right? I mean, it's pretty versatile, the texting feature, no?
Yeah, a text feature, we all live in real time, and that gives us the ability to do that.
Yeah.
We also have the ability to go online, and let's just say you have something that's been nagging you for a while.
Yeah.
Like you have carpal tunnel, and it's been, this is happening, or you have arthritis in the hand, and you need care.
Right.
Or you have back pain that's been nagging you for a while, and now you have pain that's going down your leg, and maybe you have a little numbness in your ankle, your foot, your toes. There's ways for you to connect with us. You can call, text, or you can go online and go to our Contact Us page, and our website is poasnj.org. Preventive.com.
I love that. It's like a little jingle.
Yeah.
Well, that is all the time we have for today. Thank you, Rita, for joining me on our first episode to really introduce the importance of joint health and Premier Orthopedic Associates of Southern New Jersey. In our future episodes, we're going to feature some of the orthopedic specialists, talk to some of our healthcare partnerships and community partnerships as well. So thanks again for being here today.
Deb, it was my pleasure to be here with you, and to our listeners, thanks for tuning in to Bad to the Bones, and we look forward to seeing you on our future podcast.
Until next time, keep yourself healthy and go out and enjoy life. Have a good day.